work at Eagle Nursing Home. We have medical ward, we have surgical ward, we have pediatric ward, and we also have maternity with us here. So before the patient is admitted, we make sure that the IPC is maintained, and where the patient is going to sleep, everything is okay. So before that, the nurse who is in charge of that ward is informed that there is a patient who is coming to be admitted. First thing we do as a nurse, you reassure the patient and you tell them that all will be well, and you try at least to explain to them what's happening so that they may be comfortable. After the first doses, after all tests are run, when our patient is reviewed by the MO, a final diagnosis is made, whereby this patient will be told about what is ailing them, and will be explained more about the condition, and will be told that the drugs that he or she can use. During our ward rounds, we do have lab in charge and other lab technicians, and then we have nurses, all nurses from all other wards, and then we have COs, we have MOs, and then we have nutritionists, we have radiologists, we have also orthopedics. All of them are always in the ward, so that when we are going on our ward rounds, when we have all nurses, at least a concrete decision can be made, because everyone knows the well-being of this patient. The lab tech has taken all the samples and know what the patient is, how he's faring. So the patient is explained the condition, and a concrete decision is made about this patient, so that when we are going during our ward round, we don't have some ish, because everyone is giving their views. So during our ward rounds, we also give suggestions to the patient, and then we ask how the patients are faring, because sometimes we do miss some history. So when we give the patient time to say about their history, it's another importance to our patients. And then during this time that we have COVID, we make sure all our inpatients are on their masks, and they maintain the hand washing each and every time they're from the toilet, each and every time they touch dirty things. And then as our nurses, we make sure that the IPC are taken, whereby when we handle the patient, especially the IVs, we use our gloves, and we make sure our masks are on and properly placed. In case the patient is unconscious, we make sure we do routine reviews with our MOs, and then we do routine reviews with our lab works, and then we make sure we have the turnings of the patients, the bed baths, and we make sure that the beddings are clean and warm for the patient. The cases like DM, we educate them about the diet, and we give them the side effects and the importance of what they are supposed to take. We have a nursing care plan, whereby in case you see a problem during the day, you as a nurse, you need to diagnose the patient, and you know what the patient is passing through, so that when the nurse that is coming during the night shift will just pass around what you've diagnosed and know how the patient have been faring during the day. We make sure the cardex is in place, whereby in case of any raised issue, we can follow the documentation. We make sure that the treatment are given at the right time and to the right patient, and the right drug, and to the right, if it's IV line or if it's IM. Before the patient takes their meals, we make sure the right dosage are given. After the meals, the right dosage are given, and we also make sure that the lab works that are supposed to be taken during the day are done, especially for the diabetic patient. We make sure all their random blood sugars are taken at the right time and at the right place. We make sure we gain consent from the patient, explain to the patient the importance of what you are doing before you do that to the patient. We have our counselor at place, so we have these times when we do make sure that our patients are comfortable by being done counseling and given each and everything. During our discharge, we still have that concrete ward round, whereby everyone that is in the ward makes a decision about the discharge. We make also a decision about the right drugs to the patient about the discharge, and also we explain to the patient about the return date. So before they do the mode of payment, we make sure the right drugs and every drug that the doctor have written has been taken from the pharmacy. Then after that, we make sure we've written the return dates. After the patient have already cleared with the account office, we make sure that everything is in place. The patient have been given the return date. The patient have been given, I've also been given the discharge summary, the gate pass, and all the drugs. So about our return dates, we have different types of clinics. We have the GOPC clinic, we have the MOPC clinic, we have the POPC clinic, and we have the SOP clinic. For our pediatrics, we do give them the POPC clinics, the pediatric outpatient clinic. For the POPC clinics, we don't charge for the clinic, for the consultation. It's free for the pediatrics, but the others we only charge a few amount for which is affordable for everyone. And then we do follow up for these clinics to make sure that our patients have come back for their clinics. And then about the discharge again, we do have the transportation, whereby after the patient have been discharged, we make sure that the patient is comfortable, whereby we do free transportation to anywhere where the patient is going. Wish them a quick recovery. Already they've recovered, but another quick recovery when they are at home as they are taking their medicine, and then they are taken home safely on their doorsteps. So before referral, there is consent gained from the patient. We just don't refer a patient without any consent from the relative, any consent from the patient. So after we've gained the consent, we make sure that the patient is referred safely. We have our ambulance, whereby it's affordable at a cheaper price, and the patient are referred safely. We have our EMT and our operator there, whereby they'll help you in everything for your patient to be referred safely. We do have so many challenges that at times it overwhelms us. We have patients around who lack funds to be admitted. The patient is so sick that needs admission. Another challenge that we get, we have so many myths and misconceptions around that do guard us. The patients are like, my baby cannot be injected. Like when they do believe about witchcrafts, whereby when the patient come and really need this injection like 4 times a day, the patient really need the injection, but the client is like, we cannot do the injection. So it really pains us, because we also have rights to the patient. You find a place whereby the patient receives some medication. After they are partly well, they refuse medication. That's a very heartbreaking thing, because you really know well that the condition really need a further management, but the patient is like, I'll not go on being treated, I want a discharge. During discharge, a patient is unable to pay their bills. So before anything is done, before the patient is released, we do have our social worker who helps us in that situation, whereby the social worker goes and takes concrete history about this patient and a detailed one, and then afterwards the social worker consults our able director about the well-being of this patient and about the discharge. So after they've sat down and have a discussion about the patient, the able director is able to get the total bill of the patient and finds a way to waive this patient. And after that, when the patient have already been waived by the able director, our client is able to go home safely, at least if they can be able to pay the rest that have already been waived.